Action. Camera 1, zoom out. Ready, camera 2, take 2.
Hello and welcome to the final session in our current Women Rock IT series. Today's panel of speakers will share how they have embraced their tech skills to find new ways to save babies around the world and help crisis-affected communities using technology. By being part of our live audience today does entitle you to free course enrolment into the introduction of IoT, introduction to cybersecurity, Linux and entrepreneurship. Details relating to course enrolment will be posted during today's event. I would like to welcome over 2,000 students joining us on campus from their academies and virtually over Cisco TV. In the interest of time, we'll take questions for our guest speakers today directly after the session. And if you have a question, you can tweet your question to #WomenRockIT or you can place it in the chat window. Thanks, and let's get started. I'd like to introduce today's guest speakers. Sona Shah, who is the CEO and co-founder of Neopenda, and Meghann Rhynard-Geil, is the technology for development advisor for Mercy Corps. But first, we're going to hear from Sona, who is joining us all the way from Cisco in Chicago. Welcome, Sona, and thanks for joining us today.
Thank you very much for having me.
Okay.
Great. Well, hi, everyone. My name is Sona Shah, and I'm CEO and co-founder of Neopenda, and I'm really excited to share a little bit of my background and what we're doing at Neopenda with you. Next slide. So I'd like to start off by sharing a little bit about myself. So I graduated with a degree in chemical engineering in 2011, and shortly afterwards I decided I wanted to travel a bit and kind of explore different cultures and communities. So I found myself in Western Kenya for a few months, and I was a primary school teacher out there. I was teaching math and science for the most part, sometimes Swahili or other courses when I had to fill in for teachers, and just absolutely loved all of the culture and community. It was beautiful, it was warm, and everyone was very kind and friendly. It was a life without expectations. But naturally, being there for several months, I was exposed to a lot of inequities in the community, and that really stuck with me for quite some time. I did have a job lined up at a pharmaceutical company called Eli Lilly and Company. It's in Indianapolis in the US. And I started doing research and development. I really loved the engineering health side of things, the healthcare side, really being able to use what I learned in undergrad and be able to apply it more in practice. But what I found myself thinking was oftentimes the medicines that I was helping make at this company likely may not see the kids that I was helping teach. And that ate away at me a little bit. The company was very kind to me and let me return back to Kenya to do some engineering projects with Engineers Without Borders and a couple of other groups, and so that really helped grow my passion for international development. But throughout my time, I realized that I wanted to spend a little bit more time focusing on this, so I decided to go back to graduate school to get my master's in biomedical engineering from Columbia University. And while I was there, I co-founded and started Neopenda, which I'll share a little bit more about shortly. So next slide, please. So when I went to, I took a biodesign class at Columbia that helped me walk through kind of the process of identifying what problems are and how we can develop technologies to actually solve these problems. The problem that we were looking at was why newborn mortality is so much higher in low resource settings than it is in countries like the US. We had some funding from the university and traveled out to Uganda, and this is what we saw. We saw that there was oftentimes a room that nurses call the equipment graveyard. It's really just a room full of broken medical equipment because oftentimes most of the medical devices that are available in country, they don't meet the unique constraints that we see in 85% of the world's population. And this is anything ranging from power instability or wireless connectivity or cost and difficulty to maintain some of this equipment. So even if it gets donated to these communities, equipment ends up in a ward similar to the image that you're seeing right now. Next slide, please. So if we take a step back, this image might be what you're more familiar with in a hospital ward. There's thousands of dollars worth of medical equipment everywhere. There are many nurses and clinicians that are available to care for patients. There's continuous monitoring. But oftentimes what we see is this is not translatable to a lot of the low resource settings that we work in. So there are many different global health interventions that focus on these settings. But they often focus on responding to a specific disease state, a pneumonia diagnostic, for example, or a temperature sensor to help diagnose hypothermia. So very rarely do nurses and doctors have the tools that they need to actually deliver high quality of care for patients when they're in a ward and they know that a patient is already sick. So this last image is the reality on the ground. It's a very time-consuming process to really understand what's happening with all of the patients. Next slide, please. So this is one of the wards that I've been in Uganda. In this particular one, there were 150 babies at one time and only 2 nurses. So these nurses are frantically running around trying to figure out which patients actually need attention. And they aren't given the tools that they need to really deliver the high quality of care that all of these babies deserve. So there are staggering statistics on the screen right now. 30 million newborns need special attention, some kind of additional care at or around birth. And of those, nearly 3 million newborns are dying every single year. But the vast majority of those babies their deaths can actually be prevented if we deliver high quality of care to these patients and these nurses have the tools that they need. So that's why we created Neopenda. Next slide, please. So Neopenda is an opportunity for my co-founder and I to use our biomedical engineering backgrounds to really design and innovate technologies that are appropriate for low resource settings, keeping in mind the specific constraints that exist in a majority of the world. And our first product, next slide please, is a wearable vital signs monitor. It continuously measures 4 different vital signs in a really simple headband. And then the vital signs from multiple newborns in the room wirelessly connect to a centralized dashboard on a tablet where a nurse can immediately see what's going on with all her patients in the room. And if any of the vital signs go outside of a healthy range, then the nurse is immediately alerted so she knows where to direct her attention most efficiently. So our headband measures 4 different vital signs using 2 sensors on the back. So we're very excited with all of the advances in the Internet of Technology space, Internet of Things space. There's just so many advances that we've been able to leverage with our solution. We have seen that sensors have become more powerful, they've become more efficient, more cost effective. And for a lot of those reasons, it makes technology more applicable to low resource settings where they don't necessarily have technologies like this before. So we've really focused on designing with and for our users to make sure that we don't end up in that equipment graveyard. Next slide, please. So in doing so, we're taking the known and proven science that continuous monitoring improves patient outcomes, and we're really delivering that high quality of care to low resource settings where they don't already have that. It's standard of care around the world to measure vital signs continuously for any sick patient populations, particularly for neonates. And we're helping improve nurse efficiency, decreasing their length of stay in the facility, really improving health outcomes across the board. But we certainly are holding ourselves to the highest levels of quality, efficacy, and safety for the patients, regardless of where we intend to sell the product. Next slide, please. So I wanted to walk through a little bit of our process. How did we actually develop the solution? So we started with more of our market and user research, understanding what are some of those issues on the ground. What are some of the constraints that we see? How do we design with the nurses that are caring for these patients? We entered then into a heavy phase of product research and development, really coming up with a concept. And I have another slide that kind of walks through that a little bit more. We filed a patent on our product and are currently patent pending. And then we did some proof of concept studies. So bench testing to make sure that the product is accurate, to make sure that it's feasible, all of the components involved in that. And we currently are going through clinical trials right now here in the US and in Uganda in preparation for sales towards the end of the year. So we certainly wouldn't have been able to do this without any of the partners that are listed on this slide, including Cisco. Cisco was very fortunate, or we were very fortunate to receive a prize from Cisco very early on, and that was a vote of confidence for us. It enabled us to get through more of this process. So we're very fortunate to have many of the partners that are listed here. Next slide, please. So in this slide, I show a couple of different device iterations, starting from our very first concept. It was a pink baby hat. We originally wanted the product to be in a baby hat because it provided warmth to our patients, but when we did some user testing, the nurses told us that it's very difficult to clean a hat. It's not as reusable, and so we changed the design to what is now a band. But you'll see as we go through many of the steps, we started in the lab actually creating the electronics and going through the version 2 that you see in the far left corner on the bottom. That's the product that we have today that we're very excited to be going through trials with. Next slide, please. So this is certainly, the partners I had mentioned were instrumental in really helping us create and navigate the process to where we are today, but I couldn't be more proud of our team that's being able to do this. Half our team is based in Chicago and the other half is based in Uganda. So we make sure to have that mix of culture, mix of diverse populations, and really understanding the constraints that we see on the ground. And alongside that, next slide please, we have a very strong advisory board that has expertise in areas that we don't necessarily have expertise in. It ranges from international public health to medical device development and commercialization and sales strategy. So all across the board, we have a very strong network of advisors and mentors to help us at every step of the way. But even in doing so, we need all the help that we can get. So next slide, please. We invite you to join us as we create medical solutions for where they're needed most. Thank you for your time and best of luck, and I'm excited to answer any questions that you may have for me.
That's great. Thanks so much, Sona. Amazing, absolutely amazing. The work that you do and the problems you're solving using that technology is just fantastic. Okay, we're going to hold questions for you right now. What we are going to do is cross over to Meghann Rhynard-Geil, who is the Technology for Development Advisor at Mercy Corps. And Meghann joins us over Cisco WebEx today. So we've only got Meghann on audio, but welcome, Meghann, and thanks for joining us today.
Really excited for this conversation. We can go ahead and kick it off with the video. Great. So that was just an example video of some of the work that I've been working on over the last couple of years. So I'm a technology for development advisor with Mercy Corps, which is a humanitarian aid organization that works in 42 different countries around the world. We respond helping conflict-affected populations, disaster-affected populations, and people in development contexts. So helping to make communities more resilient to environmental challenges and other conflict challenges. What I focus on is integrating technology into the programs that we work on. So making sure that the type of tech tools that our programs and our countries are using are actually useful for the program participants, for our beneficiaries. So making sure they're designed properly, that they fit for the context, and really making sure that they're useful. And I'll get into detail about that specific program in a bit. But first of all, I wanted to discuss a bit how I got here. I did not originally think that I was going to be focusing on technology with my career. I started out as an English major in my undergraduate degree, and then I started traveling. I traveled to Morocco and I lived there for about a year. I worked in an orphanage and I just loved being part of the community, getting to know a new country and a new culture, and really trying to help and feel useful. And so when I returned from Morocco, I went to grad school and I studied Master of Public Policy. So I focused on sociology, economic development, and political science. So still really focused on community-driven development. So thinking about how can we make sure that the ways that we're helping the communities that we're working in are applicable and useful for them. So I really came to technology from kind of a bottom-up approach. How can tech tools be useful for the people that we're working to serve? We can go ahead and move to the next slide, please. So I started working for Mercy Corps about 5 years ago. I started as a monitoring and evaluation manager, which is basically looking at the quality of our programs. So reviewing how our programs are performing, gathering data from our program participants about if we're meeting, their needs and we're responsive to them, and then helping programs to adapt. One of my first field assignments was working in Turkey in response to the Syrian refugee crisis in 2015 and 2016. So I was working on a research project there that was looking at what was making people make decisions to move. So how are they deciding to move to Europe? How are they deciding to leave Turkey or even leave Syria? So I was interviewing countless Syrians on a daily basis, speaking to them about what they needed and how they were making their decisions. And what struck me incredibly was that many of them were making decisions in an incredible void of information. So while they were using smartphones and they had access to the internet and connectivity, many of them were getting information from their friends and family, which was wrong. They were following Facebook groups that weren't necessarily accurate. Smugglers were often using Facebook as a predatory way to get people to pay them to cross. And so it was, despite the amazing availability of information, there was an incredible vacuum of verified and safe information. And so people were making some of the most important decisions of their lives without knowing what information was actually actionable and truthful and useful. We can go to the next slide, please. So at that point, I actually joined the technology for development team. And so we were starting to look at tech solutions. So the Syrian refugee crisis was really one of the first crises that we had responded to where most of the population was connected. They were using smartphones, they were using cell phones on a regular basis to communicate with each other via Facebook Messenger, via WhatsApp, et cetera. And so they were a very digitally literate, everyone was used to using smartphones. So it was an excellent way for us to start communicating with people. And really getting an idea of day-to-day of what their needs were and being able to speak to a scalable number of people in a way that we never had before. We had always had to hit the ground and speak to people door to door, which is, you don't get to speak to that many people in a day. And so it's incredibly hard to get useful information and make sure that you're really communicating and giving people what they need. And so there was an incredible proliferation of mobile apps that kind of sprung up around this response in Greece. Some were useful, some were less useful. We actually designed an app with the International Rescue Committee, and it was designed for information sharing. So basically, as somebody landed on the shores of Greece, They were able to download the app as soon as they had connectivity. The app would geolocate for them, so they would know, had they landed on an island or had they landed on the mainland, where were they? They would also be able to see what services were available to them in the near area. So what camps were there? What were the services at the camps? What were the registration policies to register as an asylum seeker or a refugee? So kind of that basic, really important information that they needed right away. At that point, we were only pushing information out. And so when I joined the program, it was right around the EU-Turkey deal in 2016, basically when people were no longer able to move past Greece. And so many people who were intending to move into Europe were stuck in Greece. And so they were suddenly having to learn how to integrate into a country that they had never planned to stay in before. So the information needs changed quite drastically. And that's when we took kind of a beat. We took a step back and we said, okay, is the tool that we've built really fit for purpose? Is it really helping people the way they need to be helped? And it turned out it wasn't. It was only unidirectional information. So only information being pushed out, not information being gathered. And at that point, we decided to incorporate a social media aspect to the tool. So we started reaching out to people via Facebook. We provided Facebook Messenger. We scaled up the team so that we had enough moderators to respond. We hired people who had been refugees previously, so they were able to sort of communicate from an emotional level as well as a knowledge level with the people that we were working with. And so we were able to respond instantly to the information needs that people had. So as they changed day to day, we were able to be agile and responsive to that. We can go ahead and change the slide. So within a month of the addition of social media, we saw a 20% increase for the following 4 months in users. At this point, Signpost, which is the name of the program, has reached 1.2 million unique users. Given the level of popularity of the tool and the engagement that we were able to have with people, both Mercy Corps and IRC, we were able to go back to our donors, one of whom is Cisco, and receive additional funding to scale up the program and to begin to start integrating these lessons learned into our other programming. So basically updating the way that our agencies communicate with people, and making sure that we're utilizing apps and utilizing social media and the tools that people are using to communicate and that they trust already, to make sure that we're able to meet them where they are and meet their needs. And so this is just a screenshot of our app, but basically it's a service mapping app that can be filterable based on the type of service you need. It also is connected to our Facebook page. So when we share information, we can link back to the app. Signpost has now expanded. We've been present in 7 countries. We are currently active in Greece, Italy, Jordan, El Salvador. We're looking at a few other areas to expand to, including Colombia. So our goal is to start working, in areas where there are populations on the move who are trying to identify information that they need to make their life-changing decisions. All right, we can go ahead and go to the next slide. Additionally, one of the limitations that we also recognized for accessing information is access to connectivity. So being able to get access to Wi-Fi or mobile connectivity. In partnership with Cisco, we've been able to install Meraki hardware devices in over 50 refugee camps and community centers in Greece, in Serbia, Italy, Puerto Rico, and Colombia. And so we're serving on average 30,000 unique users a month with connectivity. Something we're also working on is digital literacy courses. So ensuring that when people are logging on, if they are not used to being connected, to being on the internet, we're educating them so that they can do it safely. And we're also making sure that we're addressing gender barriers and gender gaps. It's estimated that over 200 million more men than women have access to cell phones or to mobile phones. But more women every day are getting connected. And so we want to make sure that as they're doing that, they understand what some of the dangers are of getting connected, but also what are the opportunities of being connected. All right, we can move to the next slide. So as we've developed this, what we call a theory of change, basically our hypothesis, we have really seen just such an incredible ability to respond and make sure that we're staying agile and connected to the people that we're serving. So we believe that if communities are provided trustworthy and actionable information through a safe and accessible digital ecosystem, they're more able to engage equitably with community power holders, plan for their futures, and adaptively respond to the environment. So basically what we promote is giving people access to the information that they need, that they can trust, so that they can have full independence to make decisions about their lives. We also want to make sure that the pathways to actioning that information are built as much as possible. So if we provide information about a service, we know that it's verified. We know that people can go and use that service. If we provide a connection between a local community member and a local government member, we know that that connection will be upheld by the government. So we make sure that we work with all of the stakeholders to ensure that those pathways are built and that they're maintained and accountable. We can go ahead and switch to the next slide. So this is just a look at our pathway to empowerment. Basically, what are the barriers that we address at each level of our programming to help our to help our program participants reach self-reliance and resilience. So one of the first things we address are barriers to accessing information. So that could be providing connectivity via Wi-Fi or providing devices in community centers. It could be making sure that we are providing digital literacy courses so people can safely access internet. Once those barriers have been addressed to the best degree that we can reach them, or that we can address them depending upon the infrastructure in the areas we're working, we move forward to providing verified information. So we make sure that the information that we're sharing with people is actionable. It's shared on tools that they're using. So it's shared via the social media tools that they are used to using, via SMS, via voice-related text message if there are literacy issues. So we really look at the context and we try to design the type of communication method that we're using to fit the context and fit the people we're trying to serve. We also then focus on educating the users and making sure that they're aware of the dangers of being on an online platform. So looking at the weaponization of information, such as hate speech, rumors, and misinformation, and helping to educate people about how to identify those things as they start to interact on online platforms. The next level that we're really starting to focus on this year is ensuring those digital pathways to action. So providing more clear pathways for people between governments and local community members, or between a refugee and UNHCR or even schools, helping refugees who are integrating into new countries learn how to get their kids into schools, learn how to get language courses, learn where the best healthcare providers are, et cetera. And so our theory of change is that basically, as we build these different levels of the triangle, we will increase the empowerment and agency of the people we're working with so that they're better able to make decisions and to make safe decisions about their lives. We can go ahead to the next slide. So as I mentioned earlier, we're expanding. Currently, Mercy Corps works in 42 different countries, but our team is engaged in several countries at the moment. So we're working in Italy, we are working in Greece and Serbia, we are working in Jordan, all responding to the Syrian refugee crisis there. We are also exploring the the Venezuelan response. So we will be starting to work there in July. We're providing connectivity in Uganda, and Puerto Rico, Greece, and Italy. And then we're also exploring rolling out in Tajikistan, partnering with local governments to build a mobile app that helps local community members communicate with their government. We can go ahead into the next slide. So as I mentioned, I definitely didn't come at technology from a tech background. I kind of learned as I went. So as a monitoring and evaluation manager, I was dealing with data. I was building dashboards. I rolled out several different mobile app tools to help with the monitoring and evaluation work that I was doing. Excuse me, I learned as I went. One thing that I will say is that I do wish that I had, I'd had a chance to go back and, take some more classes in coding. I would just strongly encourage, the more access you have to technology classes, the more access you have to opportunities and amazing job opportunities and creativity and freedom with your work. I can't emphasize enough how much I love working in the technology for development field. It's an area that's always changing. It's close to the people that I'm working with. So I'm in the field, I'm working with program participants. I'm able to see how our technology is helping people every day. And it's a constant learning experience because technology is always changing. So every opportunity I get to take a free course or to, build my knowledge base so that I can be reaching program participants better, I take it. And so I can't emphasize enough taking those opportunities. So thank you very much, and looking forward to questions.
Thank you, Meghann. Great to see what you're doing at Mercy Corps, which is so very, very important. And I love the idea of taking free courses because we're offering them today. So we have actually placed the enrolment link in the chat window if anyone wants to take up the opportunity to do some courses with us here at Cisco, which are free, 100% online, and very quick courses to do. So we're going to cross over now to take some questions. We've got quite a few coming through on social media, but I might just start with a question in our room because I know that you've got a question you'd like to ask.
I do. I have a question for Sona. Just wondering, how is your product broader than just the technology you use?
Yeah, that's a great question. So certainly with working with our users, we see that technology is one aspect of it, but there are so many additional aspects. There's thinking about how do we actually implement the solution? How do we encompass education, training, not just on how to use our device, but how to respond to vital signs when they're out of range, how to maintain the equipment. Technology inevitably breaks, and so how do we make sure that we're on the ground repairing it whenever that's needed. So it's really thinking about that full comprehensive solution as opposed to a single technology.
Thank you.
Okay, we've got another question that's come off social media from Lauren, and she wants to know, this one's for you, Meghann. What do you see as Mercy Corp's biggest opportunities in the future?
That's a good question. Excuse me. I think related to technology, something that we're really looking at is AI. So how can we better utilize that in the field in a useful and applicable way? So that could be predictive analytics so that we can better understand, the context that we're working in and make sure that our teams are safe, that our distributions are getting where they need to go, that we're able to start looking at weather patterns and identifying those so that we can help build capacity of the local farmers that we're working with to respond to those. So that's one huge area. Another area that I'm working on in particular is thinking about how can we use machine learning for translation. So, many times humanitarians land on the ground and we don't speak the language that our program participants do. And so how can we help to facilitate a closer relationship between people who don't speak the same language in a crisis context? We're also looking at things like bots. So, how can we maximize our time and our ability to respond to people's needs as they respond to us on chat, so that we can, help people to get the help that they need as quickly as possible, but as efficiently as possible as well. So those are a few of the areas where we're really focusing on the next couple of years.
Pretty exciting. Thanks, Meghann. We've got another question that's come in over social media from Sashi, which is for you, Sona. Is it risky to have sensors on a newborn baby's head? And how is the tech changed to achieve safety? And also, how do you test your product to make sure it is safe?
Those are all great questions, and certainly safety is of utmost concern for us. The last thing we would want to do is harm the patient in any way. So we do extensive safety testing. We go through a process called the Design Failure Modes and Effects and Analysis. It's DFMEA or PFMEA. And it goes through the process of identifying any potential hazard or risk that could happen from our device. What could our device do that could cause harm to the patient? That could be anything like the strap on the band rubs against the baby's skin and causes a rash, to the battery overheats and causes it to burn the patient. So it thinks through all different scenarios of what that could be, and we go through very, very extensive testing to make sure that we're applicable for international standards. And we're certainly safe for use on patients. So that's the testing process that we're going through right now.
Yeah. Yes, sorry. I was on mute. Yeah, we have another question for you is how did you come up with the name Neopenda?
Yeah, so Neo is for baby and Penda is part Swahili for love. So baby love is where we came up with it.
Oh, awesome. Okay, Meghann, another question that's come off social media from Nizar. He wants to know if there's any specific courses related to what you're doing right now at Mercy Corps. ICT 4D?
Yeah, that's a very good question. There are starting to. So it's a relatively new field. I would recommend just doing a search for ICT for D. Harvard Humanitarian Initiative actually works extensively with ICT for D, so helping to make sure that as technology is integrated into these programs, with incredibly vulnerable populations, that we're not increasing their vulnerabilities. So we're doing it in a safe and ethical way. So that's an interesting area to be looking at. I would also say in general, the University of Michigan has a very good development program that you can study. It's not tech focused, but that can get you on the development side. If you're really interested in the tech piece, I would say looking at things like human-centered design for mobile app development, that's an incredibly important skill. Data science and big data is very, very important in our field, and it's getting more important as we have access to larger data sets and we're able to use those in the context in which we work. Anything around monitoring and evaluation and learning is very useful and relevant so that we can constantly be helping to improve our programs. And then, as I mentioned earlier, I think AI is going to become more and more important as it becomes more applicable in the context that we're working. So those are the few areas. And then another branch, and I think something that's going to become more relevant is connectivity. So I think GSMA estimates that by the year 2025, 71% of the world's population will be mobile subscribers. So working in that field, especially in some of the harder to reach areas, that's going to be a really interesting place to be working in the next 10 years.
Great stuff. Thanks, Meghann. Okay, we have time for one more question. I believe you have one more question.
I do. A question for Sony, please. You're delivering a great product to people in need, but do they have enough human resources in order to teach them how to use it?
Yeah, another great question. So we are delivering our solution to be, we're designing our solution to be used in facilities where we know human resources are troublesome. There are a lot of global health initiatives to try to strengthen and build capacity in these hospitals to really help improve what's happening on the ground. We're designing our solution to empower nurses to give them the tools they need to really deliver high quality of care without needing additional resources. There are cost-effective means and mechanisms to treat patients once you know that a baby's actually in trouble, and by providing a centralized dashboard, a nurse can just look at one screen and she can kind of tell what's going on with all of the patients in the ward.
Thank you very much. That's all your questions?
I have one more question for Sony. Is this product available for home users, for mothers, for example, who maybe their child is ill and they want to monitor the progress of their temperature or how the baby's going?
Yeah, not yet. We're focusing on hospital settings to begin with. There is certainly room to expand the product to other patient populations and use cases, potentially at home as well, but starting in facilities where we know the patients need the vital signs monitor.
Awesome.
Thank you.
That's great. That's all we have time for today. So thank you very much, ladies. I know it's incredibly late in Chicago and also where you are in Palm Springs, Meghann. So we really, really appreciate your time. You're both doing such incredibly amazing work, and we're really, really excited to have you on today and very proud that you were able to share what you could with us. So that's all we do have time for. All presentations and recordings will be made available after the session today. Please check back on our Women Rock IT website for details. we have placed the link in the chat window. As a reminder, by being part of our live audience today does entitle you to free course enrolment into 4 of our Cisco Networking Academy courses. Again, we have placed enrolment link in the chat window. And that's all we have time for in terms of today, but also it's the last of our session, our series, which was 4-part. We will be running a new series coming in August, so look out for details which will be placed on to our website. Until then, thanks for joining us and have a great day.